equity and health go hand in hand. And you're not going to be able to get the bigger impact in health if we don't look at equity. And really reaching the most hard to reach, the most vulnerable, requires extra effort. So the only way we're going to be able to do it is we have to pay more attention to it, be more conscious, look at the data more carefully, see where we have to go, and be more deliberate, more purposeful in reaching the most hard to reach, and making sure that you've got equity not only in access and coverage, but also equity in quality of services. And so this is really critical to be able to make sure that you're reaching all women everywhere, regardless of where they live or their economic status or any of their demographics. So, I think I want to for a minute reflect on the COVID-19 pandemic, where it just showed how interconnected the world is. I mean, in so many ways, we learned from each other all over, and there were some really key lessons that came out of the pandemic, despite all the big challenges we faced. And one of them is that almost everyone in this entire global health space, whether you look at Global South or you look at countries in Europe or in Asia and others, we all have something to offer in this entire impact on global health that we want to see, and including gender equality. I think some of the pieces that we've seen in the Global South as well as in Europe is really the sort of, I would say, the participatory processes that are there in terms of policy making, in terms of decision making. Yes, there are challenges. Yes, we are still not where we want to be, but we do have countries in Africa that have really given attention to women in leadership positions, for instance, and really making sure that they're making deliberate attempts to track that and making sure that women are able to have that voice in decision-making, policy shaping. There's also been good experiences to show how civil society movements can really inform and be part of the response that we want to see in gender and health. So there are those kind of, sort of solutions, I would say, that have been seen more in the local context. And adapting solutions to local context, understanding the problem in the local context is something I think across Africa we're seeing more and more, because it's not just, this is one size fits all, everyone does what we have to do. So I think anchoring the response to the local context is something quite uniquely seen in Africa, including some of the innovations that have come from the challenges on the ground. Many times you don't have all the resources you have. So you have a lot of the new thinking, creative thinking, the young people, the entrepreneurship and things like that you see on the ground in the Global South is really another piece on gender equality and health together that one can learn and adopt in a broader sense globally. So I think currently the world is really in a very difficult situation. I see most dialogues and policymakers and decision makers is really the challenge about financing and budgeting and what do we prioritize over what. And there are many competing challenges. There's no doubt on it. I mean, the pandemic showed us that there's a lot of health security dialogue that's happening. There's a lot of climate dialogue that's happening. There's conflict and humanitarian challenges that everyone's facing, and refugee areas of attention that are needed. And to me, it's definitely not an either or, but it's at this point in time when all the more we need to double down and continue the support to gender equality and health and those areas that are typically sometimes the first to get cuts and to get, sort of deprioritized. But actually, it's just the opposite. The more we would prioritize this, the more the impact on the other areas that we want to see. And so the one thing would be that let's anchor ourselves in the data. Let's learn from the lessons that we know and we've seen, and let's not do an either or, but look at a much more joined up way of integrating our responses so that we can have a multiplier sort of catalytic impact across the board. Otherwise, you're in a risk of taking away funding from something that is actually going to then come back in a few years and, destabilize and reverse the gains that you have made for so many decades. And we don't want to go backwards. We want to go forwards and go forwards together.